The COVID pandemic is a global health crisis. It affects us all, but children are particularly vulnerable. Lockdown and school closures have put extreme pressure on many families, and children are often the first to suffer. We know that during the lockdown, vulnerable children have been more exposed to abuse and violence in the home. Because of the lockdown, support to these children from teachers and social workers has mostly stopped. This leaves children cut off, isolated, and often desperate. The NSPCC, the children's charity, has reported a big increase in calls to its helpline from children suffering abuse. Children need our help, and they need it now. We encourage children to disclose abuse, but during the lockdown, the government has now removed much of the support that might enable children to make those disclosures. As adults, it's our duty to safeguard children and ensure that they feel safe, secure, and cared for. So we need to reverse these government changes, and we also need an urgent national strategy to ensure the most vulnerable children in our society are protected. Along with many organisations, we're working to reverse the government changes and to get a better strategy in place. If we don't act now, the trauma inflicted on children will cause long-term harm. We can't allow the cure to COVID to be worse than the disease.